Hello, I'm Mark Litto. I'm an actuary and spent most of my professional life as a principal at Milliman, one of the largest actuarial consulting firms in the United States. I specialized in healthcare system design and management and worked with major private corporations and governments around the world. I have retired from Milliman, but continue to consult and now serve as a director of the Concerned Actuaries Group, a 501c3 nonpartisan organization of actuaries dedicated to providing policymakers, the news media, and public with accurate and easily understood analysis of the financial realities affecting the funding and security of our nation's public finance and social insurance programs. I'd like to start our conversation with a simple statement. The current national discussion about healthcare in America is not really about healthcare. It is about paying for healthcare. As a result, the dialogue is concentrated on questions related to the structure and cost of public and private insurance coverage and the subsidies related to that coverage. In this narrowly defined arena, attainment of health insurance coverage is portrayed or seen as the solution to the nation's healthcare needs. Policymakers, however, are not focused on how to improve the quality, availability, and management of healthcare. They are arguing instead about how many people are insured, whether people with pre-existing conditions are protected, the cost of premiums, and the level of out-of-pocket expenses. Coverage is, of course, one of the issues that must be addressed. But we cannot find the answers we seek and need by addressing coverage in a vacuum that ignores the many challenges facing our healthcare system, the demographics driving both the usage and the cost of healthcare, the economic realities related to individual and institution ability to pay, the economic implications of the policies currently already adopted, and a host of equity issues, including the shifting of costs amongst current populations and to future generations. In short, as this two-dimensional debate rages, broader strategic and operational questions central to our healthcare needs are being ignored. Our understanding of the system is distorted, unintended adverse effects are obscured, and we are encouraged to ignore important actuarial, economic, and accounting principles. In an effort to enhance public awareness and understanding, the Concerned Actuaries Group and the Committee for a Responsible Federal Budget, both nonpartisan 501c3 organizations, are co-hosting a series of expert presentations and conversations on the broader and more complex spectrum of issues that must be considered in the search for an equitable, sustainable American healthcare system. The series, American Healthcare, Rethinking the Challenges, Opportunities, and Possibilities, will begin with an examination of the dynamic interaction between national demographics and finances and American healthcare.
The first program focuses on the interaction between population demographics, cost of care, and the impact on the payment for and delivery of healthcare. The second program looks at the relationship between benefits, usage, and costs. And the third program examines the allocation and management of public and private costs and payments. In all of these presentations, we will highlight the conclusions we think critical to informed discussion of healthcare in America and share examples of the data and research findings that support those conclusions. In this big numbers segment of the program, for example, we think it is critical to recognize the magnitude of the numbers involved in American healthcare and understand how that magnitude affects both the nation's physical and financial health. To that end, we will be talking about 5 major research-driven, data-based conclusions, including healthcare cost numbers are really big and represent a very large percentage of the U.S. economy, household budgets, and federal government expenditures. Current growth projections indicate that without any changes, future healthcare spending will require a significantly larger and arguably unmanageable share of both individual household and government budgets. The complexity of managing American healthcare is exacerbated by the large number of people affected and by the way in which they interact with the system as beneficiaries, taxpayers, and consumers. The options being considered for changing the Affordable Care Act do not adequately address the needs, complexity of, or financial stability required by American healthcare. The country cannot find the answers we seek and need without considering the demographics driving both the usage and the cost of healthcare, the economic realities related to individual and institutional ability to pay, the economic implications of the policies currently already adopted, and a host of equity issues, including the shifting of costs to future generations. With that in mind, let's begin by noting that all the numbers we will be talking about are really big numbers. We all get that $1,000 is $1,000, and we can imagine $1 million. But $1 billion is hard for most of us to envision. And $1 trillion is almost impossible for us to grasp, which is why we want to begin by putting these numbers in perspective. Think about it the way most of us think about our household bills. Suppose, for example, that you owed $1 million, won the lottery, and could pay it off in one day. You'd be debt-free this year. Now suppose instead you owed $1 billion. At $1 million a day, it would take you a little longer, 1,000 days to be exact. So you'd be debt-free sometime in 2021. Now suppose instead you owed $1 trillion. At $1 million a day, it would take you 1 million days to pay off that debt, which means you'd be making that final payment sometime in the year 4757, or roughly 2,740 years from now. And that does not recognize any interest costs, which we will address later when discussing the national debt. In 2017, citizens, employers, and governments spent roughly $3.5 trillion of their family wealth, corporate income, and taxpayer dollars on health care. That makes health care expenditures about 18% of the entire gross domestic product of the nation. If we spread that number across the entire U.S. population of 327 million, we discover that's an average of nearly $11,000 per person in the country. Now, obviously, no single amount applies to every man, woman, and child, and widely different amounts apply to different groups, depending on age, health status, economic status, and other factors. And we'll be talking about that in the next segment of this program. For now, let's take a look at the conclusion that the magnitude of the numbers and current growth projections indicate that without any changes, future healthcare spending will require a significantly larger and arguably unmanageable share of both individual household and government budgets. And let's start by pointing out that these are numbers that affect all of us. Consider, for example, that the Bureau of Labor Statistics reports that in 2016, average household healthcare expenditures were just over $4,600, which would suggest that healthcare expenditures are the sixth most expensive item in our budgets, behind housing, income taxes, transportation, food, and personal insurance pensions. The truth, however, is that when all consumer costs are calculated, average households across the country spend more on healthcare than on anything else, including housing and taxes. These BLS statistics only count a household's out-of-pocket healthcare costs. A large chunk of the income taxes column goes to healthcare, to pay for Medicare, Medicaid, and the ACA. In addition, the money that employers pay for healthcare, since it is part of their pay package, is really both earned and paid for by the employees and their households. It is not reflected in these BLS numbers. A better way to measure average healthcare spending is to simply take the average healthcare costs of $10,700 per person and multiply it by the average number of people per household identified in the BLS study as 2.5. Average household healthcare spending in total, then, is really nearly $27,000, making it the largest household expenditure. With our household budgets in mind, let's now take a look at our national budget. These 2017 budget allocations tie into the latest CBO estimates, and as you can see, federal healthcare expenditures for Medicare and for Medicaid, ACA, and CHIP rank second and fourth in total expenditures. If we combine the two, healthcare expenditures rank number one and account for more than 1 of every 4 federal dollars spent. These already big numbers are projected to grow even larger, which raises questions about what such growth means for personal and governmental budgets. Rising healthcare costs are a reflection of rising enrollments in the nation's two major healthcare programs: Medicare, which primarily serves those 65 and over, regardless of income, and Medicaid, which serves those in financial need. As the baby boomer generation grew older, Medicare enrollment increased 31% between 2008 and 2017. Medicaid enrollment increased 54% during the same time frame, for a combined increase of about 40 million people, which raised public health care costs by about $541 billion, or 66% over the past decade. The large numbers of people affected by these government programs as beneficiaries, taxpayers, and consumers greatly complicate the health care reform process. And keep in mind that these costs, combined with estimated increases in private expenditures, are projected to grow even faster over the next decade. Medicare and Medicaid expenditures, for example, are projected to nearly double, with Medicaid costs increasing 66% and Medicare costs growing by 85%. At the same time, private health insurance is projected to increase by 50%. And so, the combined projected cost increases will raise annual healthcare expenditures met by third-party payers from $2.55 trillion to $4.17 trillion, or an extra $1.62 trillion per year by 2026. What all of this underscores is that both the enrollment numbers and the financial numbers are so large that any change in benefits, pricing, or usage will have a massive impact on the population as a whole and on governmental and private sector budgets. Do the math. Take the 59 million people enrolled in Medicare, add the 74 million people enrolled in Medicaid, and subtract out 11 million dual eligible, and you are up to 122 million covered by those two government programs. Add the 176 million people with private insurance plans, and you are talking about 298 million people whose interaction with the healthcare system, including third-party payers, can and does dramatically affect the cost of healthcare in America. Suppose the cost of paper or aspirins or electricity or Band-Aids goes up by just $1 per person. The volume turns that $1 per unit cost into more than $250 million system-wide cost. And the question then, of course, becomes what happens to household budgets if healthcare costs go up faster than income? Suppose, for example, that over the next decade, healthcare costs go up about 5% a year, a reasonable estimate based on current government and private projections. At that rate, the household health care costs shown would increase from $4,612 to $7,155 a year. Now suppose that all other household costs, including taxes, would increase by about 3% a year, increasing from $70,000 to a little over $91,000. And finally, assume that household income goes up at about 3% a year, rising from $74,644 to nearly $97,000. When you put all of that together, what you discover is a growing gap driven by healthcare costs that rise faster than wage growth. A gap that in this example would cost each household more than $5,000 between now and 2027, which would cost America's 130 million households about $672 billion. And keep in mind that the numbers in this example are all based on the $4,612 household cost rather than the considerably larger and more complete cost that includes healthcare costs incurred by households but financed through third-party payers, especially employers and the government. The larger cost estimates are based on Bureau of Economic Analysis data, which indicate that health costs amount to about 20% of gross household income, a number consistent with the BEA's generally accepted conclusion that healthcare accounts for 18% of GDP. We will address these additional income and expenditure amounts and their sources in more detail. But in the meantime, it is worth noting that a projection based on BEA data suggests that the impact on households would be in the trillions. These projections clearly indicate that people, households, governments, and employers face significant challenges if healthcare costs continue to rise faster than wages and other costs, driving consumer spending to healthcare at the expense of other goods and services. Consider, for example, the different types of consumers and needs we expect our healthcare system to address. We have populations diversified by age and gender, populations affected by being urban, suburban, or rural. We distinguish populations as being covered by different sorts of payers and insurance or welfare mechanisms, and all of these differentiations are further complicated by the type of usage and challenges requiring attention. The size of the numbers involved and the complexity of the demands being placed in the healthcare system make clear that the options being considered for changing ACA do not adequately address the needs, complexity of, or financial stability required by American healthcare. We can see the complexities and the costs, but when we look at the options being proposed, we see limited adjustments that revolve around, on the one hand, more or less benefits being discussed in the context of restricting or expanding subsidies, and on the other hand, a debate over increasing or decreasing taxes or increasing or decreasing deficits. This limited definition of the issues focuses the discussion on an artificially narrow debate over federal, and to a lesser degree state, budgets and deficits, rather than on a broader discussion of what is working and what's not working, and how to achieve the financial and managerial discipline required to support a sustainable, equitable healthcare system. Achieving that financial and managerial discipline is essential because the numbers have grown so big that they now clearly threaten our ability to provide adequate funding for other government and private economy needs. Consider, for example, that in 2017, healthcare expenditures account for 27% of the entire federal budget. Consider also that these healthcare expenditures are projected to grow by more than $1 trillion over the next decade, raising the per capita cost per citizen above $18,000, and in 2027 accounting for 30% of the federal budget. Now look at the relationship between all healthcare expenditures and the gross domestic product. With current spending at $3.5 trillion, healthcare expenditures account for 18% of gross domestic product. Once again, ask yourself what happens if the current growth in healthcare expenditures increase as projected. Assuming 2% inflation and 2.5% real growth for a total increase of 4.5% per year, by 2027, GDP would grow to $29.7 trillion. If healthcare expenditures were to grow by 1% more than that, or 5.5% per year, they would rise to $6 trillion by 2027. Finally, we should not forget that all of these big healthcare numbers we have been talking about are likely to increase the national debt. That debt stood at $5.8 trillion in 2001. But as a result of budget deficits, driven in part by growing healthcare costs, the national debt grew by another $10.1 trillion between 2002 and 2017 due to deficits. And other interest payments not included in the annual deficits, along with other federal financing, added yet another $4.3 trillion to what is now a total national debt in excess of $20 trillion. A staggeringly large number that amounts to a debt of nearly $62,000 per American citizen.
The key takeaways from this look at these big numbers and complex issues is, first, that we are facing large, significant problems, and second, that we cannot solve these massive healthcare challenges without systemic solutions that recognize and address the challenges in a far more holistic fashion. Solutions that at a minimum are based on a fair assessment of need, appropriate incentives, and fiscal capacity. The slides presented here, along with an article that recaps and expands on the presentation, and a primer on healthcare and the federal budget, prepared by Mark Goldwyn and the Committee for Responsible Federal Budget, can be found at the Concerned Actuaries website, www.concernedactuaries.org, and the Committee for Responsible Federal Budget's website, www.crfb.org. Thank you for watching this presentation on the challenges and opportunities facing our healthcare system. The next presentations, including that on big benefits, will get further into the issues and connect with what you've learned today. Thank you again.